It was pretty haphazard really, so I wasn't collecting feedback routinely. It was informal, so you tend to only get the good feedback.
So as part of doctors' appraisals, we collect feedback every year on paper forms, and the issue with that was that the questions were very generic and they were often misinterpreted and like a box ticking exercise. So the information then went into a spreadsheet which went onto your appraisal but was not available for other patients to see. And the other thing that I used to have was another option for patients to write a testimonial that I could send them a link after clinic. And the issue was that doing that was not very successful in that patients just didn't have enough time, the parents didn't have enough time to fill this out after they had come to see me to help with their child's allergies.
I'll be honest, I wasn't using any specific metric. I was assuming that if patients were returning back to clinic, they were happy. If we did receive any complaints, then that usually would be through emails or letters, which we would address.
It was pretty clunky, to be honest. We had patient feedback forms at the front desk. The patients found it a bit of a faff to do.
Well, we did use traditional methods, really just a patient questionnaire. So when patients came to the centre after their consultation, they would fill in a fairly simple questionnaire. It was difficult because always the questions were relatively limited and people usually were rushing. They would certainly leave comments, but it's so much better being able to get comments through Doctify. I think they're more accurate and I think they're more reflective and therefore they're more valuable to us and then ultimately to our patients.
It was mainly written feedback. It was very much ad hoc. It was cards. It was sometimes it was champagne. It was quite nice. That was one.
We actually used a paper-based system initially, and then that would capture the data. An administrator would then input this into an Excel-based system, which will then generate our reports for us on a monthly basis. So that was our initial capturing method. So there's some frustrations in that it will take a while to process this information. We'd have to wait at least a month before we see the results. So the meaningful cycle of the data capture wasn't really efficient enough in our view.
What key frustrations was with Trustpilot was that it wasn't specific around healthcare services in particular, and the categories were not very specific. And the second point was around the ability to get instant connectivity between our website as well as Trustpilot's website at the time. Those were the two key frustrations that we had.
We base a lot of our service improvement through patient feedback. It's so important. Ultimately, they use our service and they are the service users. So finding an effective way to capture that and integrate that into our improvement plans and quality improvement processes is really important.
I think it's really important. In fact, it's probably one of the most important things we do, because if we don't know and understand what our patients' expectations and requirements are, then it's obviously very difficult sometimes for us to just guess.
From a governance perspective, from a GMC perspective, from a transparency perspective, it's super important to have patient public engagement and interactivity at the heart of what we do. The whole point about feedback is that you learn and you get better. So it's super important to have that sort of feedback on so many levels so you can improve, so you can give true quality care to patients.
We're always trying to improve our service. Obviously it's a competitive industry, especially the private industry, so having honest patient feedback is so important. We take as much out of the negatives, of which thankfully there aren't many, as we do out of the positives.
You can't benchmark it if you do your own, and so the obvious way is for patient feedback, because at the end of the day what we're all here for is to make the patients better. I think it's one of the most essential things that you can do in medicine. It's only through patient feedback you're going to get the two things. Firstly, what your medical skills are doing, and also what the whole experience of the patient is.
I think it's really important on a number of levels. I think it's important for me personally to hear from patients what they found useful from their consultations and the care that I've given them, and the areas where I may not have been aware but that was lacking in some respects the care wasn't quite what they were expecting. I think it's important for me to be able to get a sort of presence out there or on the internet so that patients who may be thinking of coming to see me or already booked to see me but want to know a bit about me beforehand can actually not just access what I'm promoting about myself, but also access what other people think about me and about the care that I've given them. And it's really important just in general for doctors to be able to have some sort of feedback mechanism that's in the public domain.
It was one of the easiest things I've ever done.
I must say it was very easy. The process of capturing data, very straightforward. It would take patient a couple of minutes and we got it implemented quite quickly actually.
Right from the start, one of the things that we liked about working with Doctify was the ease of working with the team. The technology that we started off with was very easy to integrate, and we got off to using right at the start when Doctify came on board. We adopted the technology and yeah, we found it very easy to use.
The app changed things a lot for me. So using the app and getting the app on a device, on a tablet in the surgery means that I can just leave it there and they'll have the consultation, they'll leave, and then they'll go to the office with the secretaries to sort out their investigations or whatever it may be, their follow-up, and the secretaries at the end will prompt them to look at the device and fill out the questions. Many people are happy to do that.
Over time, it's almost become like an extension of our team in terms of the way the two teams integrate together and innovate around how we can better, one, capture the feedbacks of the patient and then also use it.
When I met the Doctify team, they just stood out completely from the rest. You can see that they were about innovation, the model was very different. And one of the things that I personally really kind of appreciated was the fact that they were open to me being different to the other podiatrists or other medical professionals.
They seem to understand medicine quite well, so I quite like the fact that it's a young company, it's innovative and it keeps on changing.
I must say the team are very agile, responsive, very accessible. I think that's very important. We always look at that in any partners we work with.
Doctify has a really great widget that you can put onto your website, and I've also found a way to import them onto my homepage so that I have real-time reviews coming in every few weeks from Doctify onto my homepage.
Yes, I mean we are using this on our website now. We're actually starting a newsletter that we provide really for educational purposes, anywhere where we think people will read it.
On our website, on Freedom Health website, we've got the Doctify banner there, and obviously that updates with all the reviews that we have. And I think that's really useful because even if patients aren't aware of Doctify, they can see the reviews, and then perhaps if they want to delve a bit deeper, they can click on the ads and go onto the Doctify website itself. So I think that's really useful.
On our materials, we use the Doctify stars that we get as a result of the service it provided. Partly is a reinforcement of the difference between the service that we provide and a social proof to customers. Then also on other materials, on our billboards, out of home, on our press ads that we do, we use the reviews as well.
The more reviews I have, the more exposure I have. When someone's looking up for a clinician, they can see that I have 212 reviews right now. That in itself helps the decision-making process when somebody's looking to find a new podiatrist. So yes, it brought in so much more clients into my clinic than I had previously, where I was relying on other forms of marketing.
Over the years, we've focused a lot on delivering excellent service, and it's sometimes difficult to get this across in a really neat way. And I think the Doctify platform has really enabled us in a credible healthcare environment to be able to get this point across. It cuts through with customers, and they realize that they have an high expectation of what to expect with Optegra, and we know that when they do come in to see us, we're able to fulfill that.
An immediate impact is that patients read these reviews. Anything that can help me almost win the confidence and trust of that patient as quickly as possible can't be underestimated. So patients do tell me we've read the reviews, and that's quite powerful.
We can see the changes in the environment in terms of people wanting things real time, people wanting access, people wanting to be able to do their own verification. And healthcare is now facing that. So people being able to go online to do searches and sometimes going in to see doctors, sometimes more informed or about their condition than they would have been in the past. And I think that means that in terms of reviews around how particular clinics, sites and hospitals are performing and being able to get that real time and access to it really easily, it's critical. And I would expect that this phenomenon will only grow as time goes along.
There's so much information out there, it can actually become quite overwhelming for patients, quite scary, quite damaging. You do have to embrace things like patient reviews. I think not just me, but I think trusts are doing that as well. I think they recognise, healthcare recognises the importance.
I think that we all look online now when we are doing anything. I'm sure that people are highly discerning, they're educated about where to find the best service. I think particularly because we work obviously a lot of the time in the independent sector, people want to know that they're getting really good value for money and that they're finding the best doctors.
Parents have told me that they looked me up online and that they found things on the internet that made them keen to come to see me.
You have a patient group which is becoming much more knowledgeable. People want to be able to access treatment quickly, and I think technology has a key role in that. We've been able to take on board some of those feedback and make changes at the hospital. One of our key aims of implementing Doctify was to increase our response rates. Of our inpatients, we have over 90% of inpatients who have left feedback via Doctify. Previously, this was less than 50%.
Embrace patient reviews. It's as simple as that. You're doing it anyway, and patients can write reviews about you anyway, whether you want to or don't want them to. It's important to engage with it in the right way and actually sort of make it easy. It's a core component of validation, seeking back patient reviews. General Medical Council, it's at the heart of that. So why not use technology to make it easier for you to do so?
I think the single biggest reason to recommend Doctify is because Doctify has got a platform that I believe that it's for the future. And I think that those who are partnering and working with Doctify's platform are future-proofing their business.
Patients can look up their doctor, look at a number of ratings. They know it's not biased towards the doctor. It's a neutral, independent agent. I think that gives them greater autonomy and empowers them towards choosing doctors, especially in private care.
The bar is high. Most doctors really like that type of challenge, and I would say that you have to be endorsed by Doctify.
It's a reliable, trustworthy, efficient platform for both the clinician and the patient. They're really reshaping the whole patient care and experience, which is benefiting both clinicians and patients. It's an exciting brand, it's an exciting project. The whole experience is, for me as a clinician, has been very smooth. I felt supported, I felt motivated to want to expand and develop my practice.
The reviews and the app that you have that makes it possible to do a very quick, speedy review in clinic, that has transformed the way that I have been able to collect reviews.
I think the brand works really well on the internet with the star ratings. I think it's much more specific than some of the more generalised ones such as Trustpilot. I particularly like the way it's integrated with the reviews, the fact you can get straight through to see the doctor's timetable. I think it's the industry leader at the moment. Personally, I think it's also incredibly cost effective. When I first took it up, I had a conversation with I think it was Henry who came to see me, and I sort of said, well, I'm not 100% sure on the business side. And he said, well, give me a year and let me prove it. And within a few months, it was clear it was worth it. I think it's also something that's necessary, and I think it's probably the best in its class, and I don't think there's anything else that comes close to it.
I would recommend Doctify. I think I would say, look, it's really important to have an internet presence that isn't just your own website, but is a lot more interactive. Doctify it still feels a bit like a startup, which isn't a bad thing. It's a young, dynamic company that's quite responsive. I wouldn't suggest anything else.